Cumbria Health on Call have been trying to come up with a way of delivering services more efficiently in a geographically difficult region by introducing video consultation.
Instead of the consultant seeing you face to face, they would be in a remote location, perhaps where they normally work, in a different hospital setting, and you enter a virtual waiting room with a virtual receptionist that will basically take your details, check you are who you say you are, and make sure that the connection's correct and put you in touch with the consultant to have your consultation. So what's really important within healthcare is that the network is secure, and that's been tested, and it also means that when the patient is in that consultation, there's only her and that whoever else is in the room with her and the consultant, and as soon as they switch that call off, there's no chance of her then linking into other consultations with other patients.
The system has been trialled in Cumbria already and has seen some success.
So we've used it in Millham Hospital, Haverick Prison, some pharmacies in Cockermouth, and in care homes across the whole of the county. But it obviously saves them time with their travel, being seen more locally, and it obviously saves the clinician time, which increases the capacity to have more patients within their clinic.
The first pilots of the scheme were in mental health clinics with a medic in Penrith and patients in West Cumbria, and oncology between Whitehaven and Carlisle.
We spent quite a bit of time looking at solutions, and we came up with a solution that they've been using in Australia for a while. So as you can imagine, quite geographically challenged. The system that we're also using has been utilised quite a lot in Scotland too. They've been using it for over 2 years, and they've also found lots of benefits with it. So we felt we could utilise all of that knowledge and experience when we implemented the system.
But the final details are not nailed down, and CHOC are looking for opinions from residents.
We also make sure when we utilise the system that we capture as much feedback as we can from patients and service users. We also have a function coming up, the Working Together function, where we will be capturing all of that feedback. The Working Together event is at Whitehaven Golf Club on the 30th of October. And so far to date, over 90% of the people that have used the system have said they would use it again.
Patients who don't have the technical equipment necessary can book in for traditional consultations or go to a more local hospital where the technology is available.
And if it works well, which so far it has been, we then will say where else can we roll it out to. It's very important also to remember, particularly from a patient perspective, is that this is not a silver bullet, it's not a panacea, it's not going to be a fix-all, it just gives another option. And we're hoping that it's going to save people time, it's going to save them mileage, but not just patients, but carers and family members. And we're hoping we will still maintain that quality of service.
The system is particularly useful for specialists who may not be based in Cumbria at all, but in more populated larger hospitals around the country.
The pilots that we're doing is with paediatric nephrology, that's children's kidney specialist. So he now stays in Newcastle. The children that previously used to have to travel to Carlisle can consult with him remotely. He does, instead of having to do a big clinic every 3 or 4 times a year because he had so far to travel, he now does a monthly clinic so children can be seen when they need to be seen, not when there's a clinic on. He can also, you can join about 6 people very easily into the consultation, so he can bring his specialist nurse, the local nurse could be out seeing somebody else, and then sit in a car and take part in the consultation as well. And actually the child could be at school if they wanted to do that without losing school.
The Attend Anywhere system will be getting rolled out across the county as Cumbrian healthcare takes another step into the 21st century. Kieran McFadgen, That's TV.